Hi everybody on YouTube Live and Instagram Live, and today we're talking about cracking your own neck. Is it okay to crack your own neck? This is a question that I get quite often on my YouTube channel. It's the most popular video I did, and it was a pretty basic video. It was years ago when I put a spine down on the ground and I was talking about people stepping on someone else's back to crack their back. And a couple years later, I was looking at my YouTube video rankings and saw that this video that I just described outpaced all the other videos by a long shot. So I thought it would be good to talk about this because I've been working on this book called Neck Pain. I first published it in 2019, and I've started working on the second edition of this book now, which I want to include some stretches and exercises and specific recommendations for certain conditions like arthritis or stenosis or listhesis, a slippage of the vertebrae. So I really want to get into different conditions that people have that they come in to the clinic with, and then what we do to help them and what they can do to help themselves. So today we're talking about cracking your own neck, and this is a question I get in the clinic quite often. Is that okay? And I can tell when someone has been cracking their own neck because there's a different feel to their neck and the way the adjustments go. And I often say to them, did you crack your neck today? And they'll say, yeah. And I'll say, it's not a good idea. And I explain why. So often the good news is we're able to get the person to stop cracking their neck, and we do the adjustments for them. And then what happens is it provides a solution to their problem so they don't have to keep doing it over and over again. So I'm just going to switch screens here. Bear with me for a second. And today we're talking about neck pain and don't crack your own neck. And my name is Dr. Cary Yurkiw. I'm a chiropractor. I practice here in Kelowna, British Columbia. I've been practicing for 29 years now. And I've seen thousands of patients. It's over the 10,000 mark now, and a lot of those are for neck conditions. I would say probably a third to a quarter of those have been neck conditions. So a lot of people with neck problems in the clinic, and I am accepting new patients. So if you're in the Kelowna area, feel free to reach out to me. If you're not, you can comment or DM me, and I'd be happy to refer you to someone in your area. So why is cracking your neck not good? Well, first, there's 7 vertebrae in the neck, and everybody's neck is a little bit different. So your neck is going to be different than, let's say, someone else in your family or one of your friends. And so if you're cracking your own neck, what's going to happen is it's going to set up a bad pattern. So if you're kind of twisting your neck and cracking it to one side and the other side, often it's the vertebrae that are too loose or what we call hypermobile that are cracking. And it's the ones that are too tight and not moving properly, hypomobile ones, that really need to get adjusted. The other thing is not knowing the alignment of your neck or how to do the adjustments. It sets you up for a bad outcome. So basically, just doing it to get the noise or the temporary relief, and we'll talk about that in a second, is not a good idea to crack your own neck. So I would say it's not good under any circumstances to crack your own neck. And so you should leave it to somebody who knows what they're doing, like a chiropractor. And I can remember in being in chiropractic college and how hard it was to learn how to do neck adjustments. I mean, initially when you worked on a mannequin, and this is after, pre-med sciences, and then you take 2 years of anatomy and biology and everything to get to the third year in college. So by this time you have, 5-6 years that you've gone to university. And at that point, you get into clinic and you start practicing on mannequins. And then when you do practice on the mannequins, you have to do the setup properly, and an instructor evaluates you, and that goes on for quite some time. over many weeks. And then you start to practice palpation and checking your classmates. And then you get to the point where you start to set up for the adjustment, and then you get to the point where you can do an adjustment. After that, you graduate to working in the clinic, and you start working on, you start shadowing a clinician and a senior intern, and then you get to be an intern yourself and start treating patients. So it's a long process, and for a person to crack their own neck is just it's kind of reckless. You just don't know what to do. Now, I talked about the relief. When you do crack your own neck or your back, there is some endorphins and enkephalins that are released, similar to when you're in the clinic and we're checking the spots. We've done an evaluation, we have a diagnosis, we're going to do the treatments for you. And then when we start doing the adjustments, you're going to get that same endorphin and enkephalin release, which is going to make you feel better immediately. So the difference between us doing that and you doing it yourself is if you're just cracking your neck and you're not doing the right segments, you're going to get that endorphin release, but about 20 minutes later, it's going to wear off and you're going to have to do it again. And you find people who crack their own neck or back, they keep doing this over and over again to get that endorphin and enkephalin release. It's like a natural painkiller in your body, but it's not really addressing the underlying cause. And that's what we do as chiropractors, is we're going to address the underlying cause. And that's finding the vertebrae that are out of place. We call that subluxated. So we find the subluxation. We do our testing, postural pictures, x-rays, whatever techniques the chiropractor uses. And then what we do is we want to correct the alignment to the spine so that long-term we get a good outcome. So you don't have to keep getting your neck adjusted, so that we realign it so that it stays in place long-term. And we don't want you to have this pattern where it's in and out, or better, worse, better, worse. So that's when cracking the neck is good. We call them adjustments, is when you go to see a chiropractor, they assess you, they do the adjustment for you, they follow up, they are very methodical with their approach, they get the patient doing the exercises and stretches that they need to do, and postural supports and strengthening, all of that, better lifestyle, better posture, and all of that's going to lead to a really good outcome. So even me, a chiropractor, goes to a chiropractor to get adjusted. So we don't crack our own necks, and that's a very simple thing to say, that but very profound statement, that if it was good for us, we would crack our own necks, but we don't. So when should you get checked? That's the next question. And I think if you have neck pain, and if you have pain that's not going away, so let's say it's there for a few days, or it's intense enough, like sharp pain, especially when you're moving, it's got other effects to it, like headaches, you've got numbness or tingling, spasm of muscles, any of those things that are not temporary in nature, and as a result of maybe something that happened, like let's say an injury, or a quick turn or something like that. So if anything's persisting throughout the day or the next day, then it's a good idea to call your chiropractor and get checked, and then find out what the underlying cause is, and then get that treated. Because the sooner we can get to the underlying cause, the faster the treatment's going to go. The quicker the duration of treatment's going to be. The longer you wait, the more chronic it gets, the harder it gets to treat. So if I have somebody with, let's say, an old injury that comes into the clinic and says their neck's been bothering them for months, and they had a car accident a year or two ago, it's going to be harder to get a good outcome in a shorter period of time, compared to someone who, let's say, just had a car accident and said, oh, a couple days ago I got rear-ended and I'm here. It's going to be much easier to correct their neck than somebody who's been suffering for a long time. So we call that chronic when it's somebody's been suffering a long time. Acute is something short term, and in between those two is subacute. So those are the classifications we use in the clinic. If you're interested in coming to the clinic, by all means, we are accepting new patients. So if you're in Kelowna, please, you can reach out to me. I'd be happy to help you with your neck condition. If you have any questions, please DM me or leave comments here in this video. If you're not in the Kelowna area and you want to see a chiropractor in your area, feel free to reach out to me. I'd be happy to refer you to someone in your area. I've done that often for my patients that are going away or traveling or away for the winter. And please subscribe to my YouTube channel as well as our social media channels. We're very active on a daily or every other day basis. And I want to continue to provide good content to you, especially in the run-up to publishing this book right here on neck pain. The second edition is going to have exercises and stretches. It's going to talk about specific conditions and what you can do for those conditions. So it's going to be a little bit more specific and symptom-based, and I think that's going to be really great. But if you can think of anything else that we should include in the book, please let me know. And I hope you guys have a wonderful day. And if you do have neck pain, you get some help for it, and talk to a health professional.